Picture two neighbors, both retired, both 67 years old. Both spent their entire careers doing everything they were told: work hard, pay in, wait for 65. The first one opens her mail in January and finds a letter she does not understand. Something about a benefits adjustment, a new premium, a form she was supposed to file last year. She calls the 1-800 number. She waits 47 minutes. She hangs up more confused than when she started. The second neighbor opened that same letter, nodded, and went back to her coffee. Because she already knew. She had read about the change 4 months earlier. She had already made her appointment, already adjusted her budget, already protected herself. Same age, same system, completely different outcomes. The difference was not intelligence. It was not income. It was information, arriving at the right time before the damage was already done. In 2025 and into 2026, Social Security and Medicare went through a set of changes that are going to affect every American 65 and older. Some of them put real money back in your pocket. Others will quietly cost you if you are not paying attention. And almost none of them are being explained in plain language by the people who are supposed to be helping you. That is what this video is for. Here are the 4 changes every senior needs to know right now, what they actually mean in dollars, and exactly what to do about each one. Every year, Social Security benefits get adjusted for inflation. This adjustment is called the Cost of Living Adjustment, or COLA. For 2026, that adjustment came in at 2.5%. On the surface, that sounds reasonable. Inflation was cooling. The adjustment reflected that. For the average retired worker collecting around $1,927 a month, a 2.5% bump adds roughly $48 a month. Just under $580 extra over the course of the year. Now here is the part they do not lead with. That same month your COLA hit, Medicare Part B premiums went up too. For 2026, the standard Part B premium rose to $185 a month, up from $174.70 the year before. That is an increase of roughly $10.30 per month. And because most people have their Part B premium deducted directly from their Social Security check, your net increase is not $48. It is closer to $38 after Medicare takes its share right off the top. That is still a positive number, but it is meaningfully smaller than the headline suggests. And for seniors on tighter budgets, that distinction is not a minor footnote. It is the actual number they have to plan around. Here is the move that matters. Do not calculate your new income based on the COLA percentage alone. Pull your actual award letter, the one Social Security mails every December, called the COLA notice. Find the net benefit after deductions. That is your real monthly number. Budget from that, not from the headline. There is one more thing worth knowing here. Higher income beneficiaries pay more for Part B through a surcharge called IRMAA, the Income-Related Monthly Adjustment Amount. If your income in 2024, which is the year Medicare uses to calculate 2026 premiums, exceeded $106,000 as an individual or $212,000 as a couple, you are paying significantly more than $185 a month. Some brackets push that number past $500 per month per person. If your income dropped substantially since 2024 due to retirement, a job loss, or a major life event, you can file an appeal with Medicare to have your premium recalculated using more recent income. That form is called the SSA 44. Most people have never heard of it. Filing it at the right time can save thousands of dollars a year. Here is something a lot of people do not know. If you claim Social Security before your full retirement age and you are still working, Social Security will withhold a portion of your benefits if your earnings exceed a certain threshold. For 2026, that threshold is $22,320 per year. For every $2 you earn above that limit, Social Security withholds $1 in benefits. Now that sounds punishing, and in the short term, it can feel that way. But here is what most people miss entirely. The money Social Security withholds is not gone. It gets credited back to you once you reach full retirement age in the form of a slightly higher monthly benefit for the rest of your life. So the withholding is really a deferral, not a penalty. The math often works out in your favor if you live long enough, which most 65-year-olds statistically do. The practical question is not whether to keep working. The practical question is whether you have done the calculation. Take someone collecting $1,800 a month who earns $32,320 in part-time work this year. That is $10,000 over the limit. Social Security will withhold $5,000 in benefits over the course of the year, roughly $416 per month. If that person plans around last year's numbers and does not see this coming, it can create a real cash flow problem mid-year when the withholding kicks in. The move here is simple, but it requires doing it in advance. Estimate your earnings for the year before year end. If you are going to come in above the threshold, call Social Security and ask them to adjust your withholding proactively rather than scrambling to catch up. And if you are close to your full retirement age, run the numbers with a financial planner or Social Security advisor on whether it makes more sense to temporarily suspend benefits while you are still earning, then restart at a permanently higher rate. That strategy is underused and often significantly valuable. For years, one of the most vicious traps in the Medicare prescription drug program was a feature known as the coverage gap, or more memorably, the donut hole. You would hit a spending threshold, fall into the gap, and suddenly pay a much larger share of your drug costs out of pocket until you spent enough to climb out the other side. It was confusing by design, and it cost seniors real money at the exact moment they could least afford it. In 2025, the donut hole was officially eliminated. That is not a small change. That is a structural overhaul of how the program works, and it benefits millions of seniors with ongoing or high-cost prescriptions. Here is the new structure in plain terms. Under the redesigned Part D, your out-of-pocket drug costs are now capped at $2,000 per year. Once you hit that cap, Medicare covers the rest for the remainder of the year. No coverage gap, no phase-in confusion, a real ceiling. For seniors managing chronic conditions, cancer treatments, specialty medications, or any drug regimen that used to push them into and out of the donut hole repeatedly, this change can mean thousands of dollars in savings annually. That is not theoretical. That is money that does not leave your account. But here is what the change does not do automatically. It does not mean your current Part D plan is still the best option for you. The redesign changed how insurers structure their formularies, their drug lists, and their tier pricing. A plan that covered your medications well in 2025 may have shifted those same drugs to a higher tier in 2026, raising your cost sharing even within the new system. The Medicare open enrollment period runs every year from October 15th through December 7th. That window is not a formality. It is the only time during the year when you can switch plans without a penalty, and most seniors do not use it. Research consistently shows that a large majority of Medicare beneficiaries stay in the same plan year after year without comparing alternatives, even when a different plan would cost them meaningfully less. If you have not reviewed your Part D coverage since the redesign, do it now. Medicare's Plan Finder tool at medicare.gov lets you enter your specific medications and compare your actual projected costs across every plan available in your area. Use it. The difference between the right plan and the wrong one can easily be $1,000 or more per year, and the comparison takes less than an hour. This one has flown almost entirely under the radar, and for some people it represents one of the largest financial corrections they will see in retirement. For decades, two provisions in Social Security law significantly reduced or eliminated benefits for people who worked in jobs not covered by Social Security, primarily public school teachers, firefighters, police officers, and other government workers. Those provisions were called the Windfall Elimination Provision and the Government Pension Offset. The windfall elimination provision reduced Social Security benefits for workers who had a pension from a non-covered job, but also worked enough in Social Security-covered employment to qualify for benefits. The government pension offset reduced spousal and survivor benefits for people receiving a government pension. For millions of retirees, these provisions cut benefits significantly. In some cases, survivor benefits were eliminated entirely, leaving widows and widowers with no Social Security income at all, despite decades of covered work by their spouse. In 2025, Congress passed the Social Security Fairness Act, repealing both provisions. What that means in practice is this: if you or your spouse were affected by the windfall elimination provision or the government pension offset, your benefits are being recalculated. Higher monthly payments going forward, and retroactive payments covering the months since the law took effect. The Social Security Administration has been processing these adjustments, but the volume is massive. Millions of people are affected. If you believe you fall into this category, do not wait for a letter to arrive and assume everything is being handled automatically on the correct timeline. Call Social Security directly. Ask about your specific case. Confirm that your record reflects the repeal and that the recalculation is underway. For some households, particularly teachers and their spouses, who spent careers assuming they would receive little or nothing from Social Security, this change is genuinely life-altering. Monthly benefits that were reduced to nearly zero may now be restored to their full calculated amount. Retroactive lump sum payments in some cases run into thousands of dollars. This is the change with the highest stakes and the lowest awareness. If it applies to you, or to anyone you know who spent a career in public service, the conversation is worth having today. None of them are complicated once someone explains them clearly, but complexity is not the barrier. The barrier is that the information arrives in forms most people cannot parse, through letters full of bureaucratic language, on government websites built for administrators rather than retirees, through news coverage that buries the practical details under the policy debate. The two neighbors at the beginning of this video were not separated by intelligence or by resources. They were separated by one thing. One of them had the information early enough to act on it. The COLA adjustment tells you to calculate your net benefit, not the headline percentage. The earnings limit tells you to project your income before the year runs away from you. The Part D overhaul tells you to stop renewing the same plan on autopilot and actually compare. The Fairness Act tells you to pick up the phone if you or someone you love spent a career in public service. 4 changes, 4 moves, and every single one of them is available to you right now. The people who are going to lose money in 2026 are not going to lose it because the system is impossible to navigate. They are going to lose it because nobody told them where to look. Now you know where to look. That is the whole point of this channel. The real mechanics of retirement income, Medicare, and Social Security explained in plain language every single week, without the jargon and without the agenda. If this landed, subscribe, because the next change nobody is talking about is already on the way, and you want to be the neighbor who already knows.